Hello and welcome back to my channel. This is Mel's Health. I'm Mel and I make continued videos about my ongoing recovery from pulmonary embolism. So in my last video, I told everybody that I've been diagnosed with CTED, which is chronic thromboembolic disease, and that the specialist at Toronto General Hospital had referred me for BPA, which is balloon pulmonary angioplasty surgery. I'll link that down below just for reference if you want to watch that. Well, it took around 2 months for me to get any information despite constantly pestering the staff over there like the absolute pain in the arse that I am. But I have been scheduled for the BPA surgery now, and I had a chat with one of the nurses over there about the whole process. So I'm just gonna make a video today and document where I am in that process, and I'll just continue to vlog my way through this journey as things happen. I will start by saying though, if you have had any procedures at TGH or if you have any general knowledge about downtown Toronto, maybe you know places to stay that have good patient rates, or if you've got your own experiences, please put them in the comments below, because any navigation around this will be really appreciated if I can keep the costs down, because this ain't going to be cheap. So I've been scheduled for early July and I've got 4 dates for 4 separate procedures of BPA. So I'll be needing to therefore fly from Vancouver over to Toronto and stay there for around 2 weeks. I've also got via email from the CTEF coordination team over there that confirmed all of my appointments, like a patient education booklet that I'm just going to go through today because it explains the procedure and the improvements that you're supposed to see from it. So BPA is very similar in how it is performed to the cardiac catheterisation test that they do to check for pulmonary hypertension, and I had that procedure last year. So if you want to see like an in-depth look at what that entire procedure is for cardiac catheterisation, I also have another video on that I'll link below, because there was a lot of information in there. The main difference between that though, despite them being one being a test, one being an actual surgical procedure, the thing that I'm going to notice differently is the entry point, because the main entry point that is more than likely going to be used for the BPA surgeries is through the groin, whereas I had the cardiac catheterisation through my wrist. And honestly, it's been like 5 months since that procedure and I can still see the entry point on my wrist. So I do kind of wonder how my groin is going to heal after this, after getting 4 stabs. But the nurse did also say to me that, you know, wrist and neck is also still an option for entry points to do the catheterisation if needed, but the groin is the most favourable option. Hopefully I don't end up bruising and being as achy as I was with my wrist. I'll put some images up about what I looked like in the week following my cardiac catheterisation through the wrist, because I really did kind of bruise up after that and it wasn't great. But anyway, back to BPA. So the first day of it, the doctor said to me on the phone that they do a lot more mapping in the first session than they do in the others, as well as doing some of the initial unblocks. So it will start with a pulmonary angiogram. And a pulmonary angiogram is a specialized imaging test where they can visualize the blood vessels in the lungs. So to do this, the doctor will put the catheter in through the femoral vein in the groin, and you'll get injected with the contrast dye, which is the same as if you go for like a CT with contrast, for example. And throughout all of these procedures, there is a fluoroscope above the table, which is a type of X-ray machine that is hooked up to a monitor so that they get live imaging of what is going on the inside. I did experience kind of all of that during my cardiac catheterisation as well, where there was like the TV screen and I could kind of see what the doctor was seeing, because he's using that to navigate his way through. But the difference with BPA is that they're going all the way through to the pulmonary arteries and into the smaller arteries to scope out where those blockages are and where he needs to unblock. So prior to getting to that point, there'll be a bunch of blood work taken in the lead up to this, and you also get set up with an IV because you're given IV fluids throughout all of this as well. And then during the procedure, the booklet says that like 3 pieces of the main hospital equipment are used, which is a heart monitor, the blood pressure cuff, and the oxygen monitoring probe, I think is the name of it. But they're all just pretty standard things that you generally see when you're in a hospital setting. The whole procedure is also performed under just light sedation, so you are awake for it, as I was for the same test before as well, and you're able to follow like simple instruction. You'll just be like slightly tired from what I'm told, so you have to at some points like hold your breath as an example so that they can get like really clear X-ray images, so you will be totally aware during this entire procedure. Now for the procedure itself, the patient information booklet that I received lays it out in like 8 really simple steps that I'm just going to whiz through right now. So number one, you're there, you're on the table and things are getting ready to go, and the doctor performing the surgery needs to find the femoral vein in your groin, and they'll do that by using an ultrasound. Number two, the groin area is then cleaned with the antiseptic stuff and you're given all of the sterile surgical towels and it's laid out, prepped, ready for surgery. Number three, you then get the injection in the groin site, which is the local anesthetic in the groin, and that's going to numb the area. So from what I remember from this being in my wrist, this is actually the most painful part of the whole thing because it really like stings as it freezes you and you start to go numb. And that was actually the only thing that I really did feel and was quite painful. Okay, number four, I'm going to put an image up on the screen from the booklet because this is like a biology lesson from school. But the doctor will insert the catheter, which is the long thin tube, into the femoral vein, and then it follows this path. It goes to the inferior vena cava, into the right atrium, into the right ventricle, into the main pulmonary artery, and then the smaller pulmonary arteries. So his catheterization is always going to follow that path so that he can scope out in those smaller arteries where the blockages are for him to work on. They do also note that as the catheter is moving throughout you, that you might feel pressures, more specifically at the groin where the entry point is, and you might also feel heart palpitations as it goes along, like that rapid kind of sensation, which I can completely attest to because when I had the catheterization procedure to test for hypertension, I was getting those feelings, like I could feel the uncomfortableness in my arm even though it wasn't painful, and I did every now and then get like rushes of heart palpitations and it kind of felt like your heart was sitting in your throat at some point, so I do expect to feel that again. Okay, number five, once that catheter is initially put in, that's when the doctor is going to inject you with the contrast dye and it will flow all the way through into those blood vessels, and then x-rays are taken and they can see where the blockages are. So that links into point 6 because now they've got more of a map of where all of this sits. The doctor's going to navigate their way through and they're going to use the catheter initially to measure the pressures in those pulmonary arteries. That linking in nicely to number 7, where once they've got themselves to a point of mapping out which blood vessels are blocked and need the actual procedure done to them, they will go in with the catheter to those blood vessels and inflate a little balloon right at the end of the catheter into those blood vessels that have any webbing of scar tissue or chronic clots that are sat in there, and inflate the balloon to push all of that to the walls of the vessel so that you get a perfectly round vessel again for it to restore the blood flow. What that will also do once the blood flow is restored is lower those pressures within those blood vessels that were previously blocked and weren't getting anything through. Once they've decided that they've reached a stopping point for the day, because you do have to have multiple sessions as to not overwork these areas, step number 8 is that the doctor will be removing the catheter from the site, and then you have to have a lot of pressure put on the entry site for a while until they stop the bleeding from down there. And they do generally say that BPA procedures can generally last up to 2 hours. So once the procedure is all done, you are kept in the hospital overnight for a number of reasons. The main complication and the most common complication that can occur from BPA is pulmonary edema. So this is just something that the hospital staff need to check on just for that kind of overnight period, the first 12 to 24 hours once you've had BPA. So pulmonary edema is a fluid buildup in the air sacs alveoli of the lungs, and ironically it makes it difficult to breathe, which is the opposite of what we're trying to do here. The reason this is common with BPA surgery is because with the balloon being inflated in these like narrow blood vessels that were recently very underperfused, you're restoring the blood flow quite rapidly back in there. They may not always be able to handle that sudden pressure change and the restore of pressure in there, and the fluid can just go in and kind of fill any cavities in the lungs. The capillaries can leak, therefore causing pulmonary edema, which is fluid leaking into the lung tissue. And symptoms around this are shortness of breath, low oxygen levels, cough, chest tightness, and in severe cases, you have to be put on a ventilator. Due to this possible risk, you are treated with a diuretic medicine when you're kept in the hospital to try and prevent this. Another thing to note is that after this procedure, you do have to be kept laid flat for quite a few hours afterwards. This is to prevent bleeding from the entry site. It allows it to begin healing properly, and you avoid any hematomas or vascular complications. Any movement that has to happen within those first few hours, you've got to be assisted by the nursing staff. The ironic thing again is that they are treating you with diuretic medication, which makes you need to go to the bathroom, but then you're supposed to be laying flat, not moving and not bending specifically. So again, in those first few hours afterwards and when you're kept overnight, you do initially need all assistance from the nursing staff to get yourself around. And it's not until the following day when they look to discharge you that you'll be kind of walking around on your own and they're kind of saying that you're good to go. Once you are discharged though, the advice from the doctor is that for the first 24 to 48 hours after the procedure, you do remain local just in case anything happens. And then in the 3 to 5 days following the procedure, you don't do anything excessive in terms of there's zero heavy lifting, no excessive bending, and just taking it easy. So not walking long distances or overexerting yourself. It's basically just recommended for that the week after this procedure, you do just take it easy and allow the site to heal. To bring this video to a close, I'm just going to touch on how this procedure is meant to help us patients that have ongoing symptoms and blockages, but we don't require the fully invasive PTE surgery. As I've said before, BPA is the preferred method of treatment for those patients with CTED over CTEPH. And the differences I laid out those in my last video as well, so do go and check that out. So 2 things when it comes to the BPA procedure. Number 1 is that it should prevent the right side of the heart from weakening. So it stretches out those chronic blood clots or the scar tissue and pushes them into the vessels and it widens them. So by lowering the pressures in the lungs, it means that the right side of the heart isn't having to work so hard. And then number 2, because you're restoring blood flow in the lungs and improving that whole situation, it should help with shortness of breath. And with that comes an increased ability to do activity and restoring life more similar to how it was originally for whoever it is. And that overall improves the quality of life. So there are never any guarantees with this whole process. I don't know what improvements I'll see in the weeks or months after all of this takes place. I hope I do see something. I think I might do some like tangible things, like get some baselines now of me doing certain exercises or walks and seeing how out of breath I get, and then doing it again later on, just so there's a bit more tangible evidence around how the improvements might be rather than me just going off a feeling. And yeah, I'll continue to monitor my updates and document them as things go along. But if you've made it this far, thank you for watching and continuing on this journey with me. If you've got any insights, please do put them below, and hit subscribe if you want to follow on in the rest of my journey. Thanks for watching, and I'll see you on the next one. Bye.